Thanks, James. Just remind me how old I am every time I do this. But so welcome again to BC Kidney Days, and I again would add my thanks to those of Leanne and Colleen and James for all of you being here. It's always difficult to know where to start because so much has happened, and I can't tell you all the things that this community has done for patients and for self-improvement over the last year or years in 20 minutes. But I'm going to try, and this is thanks to an amazing help from Gloria, who helps to synthesize and organize and collate everything so that I don't forget anybody or anything. So I'm going to talk as usual. Many of you have heard some of this before, but it's important that we remember where we are and how we do things in British Columbia and how unique our care model is. We have undergone, as all organizations and communities do, a renewed strategic focus, and key to the theme of this meeting and everything else, optimal patient experiences and outcomes are important, as is innovation and research in renal care, and that gives people hope. Like all things, it's about the money, so we have to have sustainable funding solutions and the right technical solutions. And most importantly, as mentioned before, we have to invest in a renal community, and so sustaining that, renewing it, and helping it to grow both in breadth and depth is really key to what we're about. So in this province, we have 1 in 10 people with kidney disease. In fact, that's worldwide. Right now, registered in the renal community, we're taking care of over 15,000 people with non-dialysis renal care and over 3,000 people on dialysis, and you heard the numbers of the transplant, about 3,500 as well. And I think importantly, 50 years ago, if you had kidney disease, you essentially died. And I think it's really important for us to reflect about how much has changed in that time. In this province, we have 6 health authorities, 11 home hemo training sites, 12 peritoneal dialysis clinics, 13 hospital dialysis units, 14 chronic kidney disease clinics, and 27 community dialysis units. And it's through this network of networks that we actually deliver the care. You've always heard me say this, but I have always believed that form follows functions, and patients and their families are at the center of our organizational chart. I know that sounds really trite in this day where we all talk about patient-centered care, but when we drew this diagram a long time ago, it was pretty novel to have patients and families in the middle. And they live in their communities, and the health authorities then deliver care within those communities. And I think it's really important for us to always remember and respect that. And as a group, we actually provide overarching support for those programs, and as a renal agency, we're accountable to PHSA and to the Ministry of Health for our outcomes. The provincial committee structure is that they are all multidisciplinary. Every committee has representation from every health authority and from multiple disciplines, including patients. That has been something we've been working on. It hasn't been as front forward as it should be, but that's changing. We now have annual work plans and clear deliverables, and we're integrating research methodology evaluation and continuous quality improvement on a regular basis. Let me just quickly show you where we've come in the last decade. So we've gone from 9,000 to 15,000 people being cared for in our kidney care clinics without it in a very responsible and organized fashion. We have increased the total number of dialysis patients, but in a much less incremental way than we did with our chronic kidney disease, and it may be that the care that we're delivering and the various things that we're doing, which you'll hear about shortly, may actually be helpful in terms of stemming the tide for dialysis, as well as the preemptive transplant initiatives that Leanne talked about. This renewed strategic plan I've gone over, but basically you will have in all of your health authorities soon a nice visual that actually puts this front and center, and we know that sometimes when you come to work, you sort of get a bit exhausted, but if you sort of remember that you're part of a total community that around the province is working for all the same things, then I think that that's actually really important, and it helps to keep us focused. So in the last province-wide patient experience survey, which is something that we take quite seriously, I'll ask you what percentage of BC kidney patients rated the overall quality of services excellent or very good. 25, 75, or 82? Okay, so the right answer is 75% of patients rated excellent or very good as their quality of care. And I think that that's important because it means that we're doing very well, but we can probably do things better, and that's something that I know many of us are looking to examine and explore better. So this patient survey, I want to remind you that it is a general survey. It's a validated survey it's called McCall, and it actually is the patient experience of a chronic disease care model. It's not specific to renal, which is perhaps good because it can then be used as a benchmark. And so we've actually done this survey called PASS, the Patient Assessment of Chronic Illness Care. Not exactly every 3 years, but we were trying to do it every 3 years. And as we get being able to do it not on paper and electronically, we should be able to do it more frequently. But this is important for this, and there's some posters that actually describe this. So all our patients think that we're providing well-organized care, enabling patient participation, and managing health beyond medical care. And for that, I thank all of you, because that means that we see people as people, not just as their disease. And I think that's really something to be commended. And what we don't seem to do as well is have tangible goal setting and linking patients with other health and community services. And we can probably discuss what that means, et cetera, at various venues. The results vary by modality, and that may have something to do with the modality itself and how well people feel. And we've actually developed a quite unique priority matrix to identify areas for improvement in each modality. And people are coming to each of the different professional groups to actually, and the renal managers, to review these and come up with some tangible things to do as next steps. So working with the patients and the committees and the renal programs are going to review these results of the patient priority setting, identify and implement some practical changes, and then ideally advance this whole culture of person-centered care so that we perhaps can do this more naturally. Innovation and research in renal care is something that many of you know is near and dear to my heart. We do a lot in BC. We don't always tell everybody what we're doing, and so I think what we really need to do is not just shout to each other, but actually increase the rigor with which we present the successes to the outside world. And so we do actually conduct excellent, high-quality clinical research studies and some translational studies. There's something called knowledge translation, which is when you take something that you know works in a large study and then you translate it into clinical care. And what we've been trying to do is foster local, national, and international research collaborations, because that makes us stronger as well as contributing to the general mandate. And we also are training and mentoring young physicians and scientists, as well as exposing people from different parts of the world to what we do in BC. And those, I think, are our responsibility, but also helps to highlight all the work that all of you are doing. This is our research and knowledge translation cycle, where we acquire, assess, apply, and adapt those things. And I'm not going to read to you all the different things, but it was good to take stock of all of the activities that we're doing that actually help us in this research generation, evaluation, and then application that we're trying to do in a more disciplined fashion over time. So I think that's important for this community to appreciate. We do a lot of different types of studies because we have an amazing database. A lot of this is based on data that we have from ours and other administrative data sets. So disproportionately database studies, but 20 clinical studies, and you'll see by the different colors in the different areas from chronic kidney disease, GN, polycystic kidney disease, PD, hemo, and transplant, that all areas are actively engaged in research activities. So another question, between 2015 and 2017, how many journal articles were published by BC Renal researchers? Less than 50, greater than 50, or greater than 100? You get to vote now. Okay, so the right answer is 117, to be precise. Now, they're not all on BC data, but it gives you a sense of the publishability of the work that people are doing. And this is not just physicians, but nurses, pharmacists, and others as well. And I think it's really important. This is a total effort by many people, so we have lots to say and lots more to say. And you will see posters and articles, and at the American Society of Nephrology just now, there were at least 12 different posters and presentations that this community actually had a part in. Many of them were highlighting some of our unique strategies, networks, and successes. So I think this is all because of all of you that we can actually do this, and we're also presenting at various venues about what we do. You can go to the website and you can see by year what we're doing, both publications and presentations. And I think if you're bored or you're interested, you can go to the website and just click and see, because all the article names are there and all the authors' names, but also you'll see the variety of topics that are covered by our groups. So we got the largest kidney research grant in international history a couple of years ago. It's called CanSolve CKD, Canadians Seeking Innovative Solutions to Chronic Kidney Diseases. And it's one of 5 chronic kidney disease networks. BC Renal Agency is a collaborative partner with a lot of in-kind contributions. And the vision of that network, some of the people who are very intimately involved in that are sitting in the room, but is that by 2020, which is ghastly close to now, it's only 2 years, every Canadian with or at high risk for kidney diseases will receive best recommended care, experience optimal outcomes, and have the chance to participate in studies with new treatments. And throughout this process, we have patients at all of the various steps, including creating the research questions, understanding study design, informing execution, and then when the results are available, informing and helping to disseminate the results. That's a very novel approach, but we think that and it's not us, that this is a well-proven or wanting to be tested way of doing business, that with our patients beside us, not behind us, will actually be much more powerful in terms of getting the right studies done in the right time, but more importantly, getting the results of those studies implemented. So we're very excited to be the province leading this very large grant. From the renal agency perspective, in this 2018-19 budget, we have $189.2 million dedicated dollars for renal care. That's for direct care for kidney disease, all kidney programs, as well as dialysis programs, including equipment, supplies, and services, medications that are continually vetted and for which we are 100% accountable and very transparent in the way that they're actually approved. And we have a number of vendor contracts to try and make those prices that we're paying as competitive as possible. The indirect care is funded through the Health Authority global budgets. So we don't pay for hospitalizations, operating rooms, radiology, or lab services, because the tenet is those people live within their communities, and if they didn't have kidney disease, they would be getting blood tests and x-rays, et cetera, as well. So the health authorities are responsible for that. So that's how that works. And there's some detailed work being done on a very formal description of that should be available to people. The activity-based funding model was developed quite a while ago, has now gained a lot of interest from national and international groups as to how we've implemented it. And we've had the fortune of consulting in Alberta and Australia regarding how this works and what we do. So the funding follows the patient. There's a lot of incentives. The whole thing is built on equitable access and a standardization and reduction in unexplained practice variation. That's not the same as saying that everybody gets treated the same. All individuals are individuals, but if you standardize and take the noise away, then everyone gets the best care in a standardized fashion, and then the nuances and differences that are required, you can spend more time on. I think it's important that we appreciate that that's what reduced practice variation should lead to. And then we actually are able to roll that up and know how much to ask the Ministry of Health for each year. I'll spend a few minutes on PROMISE, which is an integrated provincial clinical information system. And why it matters is it's an incredibly critical link for both transplant and the renal agency, in which we have over 22,000 patients registered and about 1,500 users in 98 units and clinics. And so importantly, it interfaces in every health authority with the existing other systems. And I think many of you know that we don't have one information system for anything in the rest of our lives. So the notion of having one information system for all of healthcare is a bit elusive. So PROMIS actually interfaces with the Ministry of Health, the CTR, the Canadian Transplant Registry, and the Canadian Organ Replacement Registry, as well as all the health authorities. It helps us with funding, regulatory reporting, evaluation, QI, and research. And it actually is also important that it interfaces with all of the private labs and some of the pharmacies, as well as some of the private nephrology offices. And it's really important for all the various aspects of patient care. And there are many, many people who are working behind the scenes to pull the data that you see in your nice reports that you get, and a lot of data cleaning, because sometimes when we enter data for clinical purposes, it isn't as clean as we need it to be to analyze it. There's a lot of transplant information that's automatically updated in the National Registry. It helps us with seamless care, and all of our regulatory reports are automatic. So in 2018, we actually have been updating PROMIS, and so there's a new face and feel to PROMIS, and the idea is that with a different kind of agility and ability to deliver an updated PROMIS, it will become easier and easier to use. And so the third release is due for this month, where there's new icons so that you can see if patients are registered in renal transplant or cardiac clinics. The physician and patient searches are improved, and there are some new updates. And so I just encourage you to go to the PROMIS website and surf around there. We have always been accountable for everything we do, and we have a number of indicators. We report provincially and nationally. We also report to regional programs with clinical and management indicators. We actually report with and for the committees and working groups, and we support research so that people can ask questions and do deep dives to understand variation or good outcomes or problems with outcomes. And many of you may or may not have seen some of these reports, but I'd encourage you, they are intended to be public domain for the renal community. We have quite a comprehensive approach, and they're mapped to a number of other priorities for the Ministry of Health and Provincial Health Services Authority. But we set targets where appropriate. Sometimes it's not appropriate to set a target. We measure things, and then we actually assess and review to see if we're on track. So in the last couple of minutes, I just wanted to reflect on, I've given you a lot of information in a short period of time, and for that I apologize, but if I didn't, then I would feel like you weren't clear, I hadn't failed to truly represent the breadth and depth of everything that has gone on. But I want to remind us that we're the only province that has a systematic symptom evaluation, the modified ESAS, sets of protocols and symptom guides, patient teaching handouts, and pharmacy information sheets. We have first-in-kind programs, pharmacy formularies, which is the most extensive financial report for renal patients in all of Canada. It's seamless, and it's pretty impressive. We have the only provincial GN network and registry, the only provincial PKD registry, the only provincial PD assist service, and we actually have launched with BC CDC the TB screening for all new dialysis patients. And in development, we have a series of transition algorithms and patient guides, which are also province-wide. And I think that for all of the work that we are all doing in the trenches, remembering that these are the things that we truly benchmark and set the bar for is really incredible. We have all of the regional innovations are funded through the value adds. On your tables are documents that describe to you in a bit more detail. And please go and look at the posters that are everywhere so that you can see the work that your colleagues are doing. We're the only province that has, to my knowledge, a proper renal emergency response led by Bill Kane and colleagues. We live in a province with wildlife, yes, and wildfires, and lots of climate-related changes. And so we have a renal emergency management committee that maintains and implements truly provincial renal emergency responses. And May is our prep month, but we actually keep it updated a lot. So we work with World Kidney Day and Kidney Smart campaigns. We advertise, we promote World Kidney Day, and that this year it's the second Thursday of every month, the second Thursday in March of every year. And so this year it will be March the 8th, I believe. So, of all the things that we actually present and provide on the websites, we actually can track the hits. So over a 2-year period, people access a lot of the documents. So which do you think is accessed most? A, antidepressant use in adults, B, diabetes kidney friendly shopping list, or C, cleaning and disinfecting hemodialysis machines and stations? Vote now. So this will be a surprise. Actually, next slide, please. It's actually cleaning and disinfecting hemodialysis machines. 50,000 hits. However, not to be negative, like 23,000 people downloaded the diabetes kidney friendly shopping list and 35,000 the antidepressant. That's pretty impressive. This is a province of 4.2 million people, and truly the little mouse that roared, and we've got all this stuff that people continually come, so congratulations for all of the things that are on the website. Please do make use of our website and all of the YouTube resources that are there, because they are incredible and growing daily. You can follow us on Twitter and Facebook, and I know some of you do and have, so keep doing it. And I'd ask all of you to reflect, how many of you have been involved in renal or kidney transplant care for what period of time? So what's nice about that is, if we're trying to build a sustainable community, the fact that we have almost 50% involved for less than 10 years is good. It means you're still going to stay, I think, which is really important, because some of us are getting older, and we need for people to continue to renew and get excited about being part of the renal community. So that we have, as I said, almost half of you under 10 years is fantastic. And for those of you that are 10 to 20, keep staying. So part of our commitment as Renal Agency and University of British Columbia is we support a number of advanced training fellowships, otherwise known as ANTS, and I've listed those clinical fellowships there. They're combined advanced nephrology training as well as home hemo and peritoneal dialysis. There's a postdoctoral fellowship and administrative fellowship, and so what we're trying to do is grow both internally and externally people that can be part of the next generation. And of course, we have our core training nephrology fellows, and I've listed all of their names there, our pediatric nephrology fellows, as well as new nephrologists. And I think it's really important that all of these people are listed and acknowledged. I'm a little bit over time, but it's really important that also we know that there are a number of awards and honors that occur this community can be proud of. So the BC Safety and Quality Council 2018 went to the Palliative Care Committee. The UBC Department of Medicine Clinical Teaching Excellence Award went to Dr. Boileau, James Lan, and Gerald DeRosa. So 3 different health authority and institutions all recognized for their excellent teaching. The CST Research Excellence Award went to Dr. Jag Gill. Dr. Sean Barber got a UBC Dean Keller letter for outstanding academic performance, and the BC Healthcare Awards for person-centered care went to Amy Maury and Aileen Corallan. So that's a pretty impressive list to add to all of our publications and everything else. And so I can't think of a better way and to thank all of you, except by celebrating all of the successes, your willingness to address the opportunities and the challenges that we face every day with systems that aren't designed always to take the best care of patients, of victims of our own success with so much transplant that we have 80 people sitting in waiting rooms and trying to deliver the best care we can. Making sure that in times of crisis and shortage, we can have dialysis access is placed in a timely fashion and really deliver the best care at the best time. But there are over 300 who are actively involved in a committee or a working group. All of you contribute to patient wellness. And I know I say this every year, but it's not an us and them. Renal Agency is us, and we're all working together. And for that, I again thank you very much.